Hello, my name is Dr. Joel Gan and I'm the resident consultant physician from Kensington Green Hospital. I'm a specialist in internal medicine and I deal with prevention and treatment of various medical conditions. Lung cancer is a growth in any part of the lung or the airway, and as the growth is getting bigger and bigger, without control, it can invade the nerves, the bones, and muscles around the growth, causing pain or breathlessness. Other symptoms of lung cancer include a cough that wouldn't go away, or coughing out of blood, or coughing out a sputum that is very dark in color and foul smelling, having bone pain, having forgetfulness, in severe case having seizures. There are many risk factors associated with lung cancer, some of them including family history, genetics, environmental factors such as asbestos or radon gas, but the most important risk factor associated with lung cancer is smoking. 9 out of 10 cases of lung cancer occur in smokers. Lung cancer is a preventable disease. If you have not started smoking, the best way to prevent developing lung cancer is not to start. If you are currently a smoker, smoking cessation or quitting smoking right now will reduce the risk of you developing lung cancer in the future. Smoking cessation is not helpful only in preventing lung cancer, but it prevents many other diseases such as heart disease, chronic lung disease, strokes, and kidney failure as well. Lung cancer is a disease that can be detected early by screening. We screen patients by offering a low-dose radiation CT scan, and these are offered to patients who fulfill certain criteria such as smoking a number of pack years or those who are exposed to secondhand smoke for a number of years. If a person is still smoking, for example, he will also benefit from this CT scan. Doing this CT scan helps us to detect small or early nodules or masses that we may not detect on a normal chest X-ray. If we find that there is an abnormality on the low-dose radiation CT scan, we then proceed with other tests such as a normal dose CT scan or bronchoscopy to obtain tissue biopsies so that we can look at the cells under a microscope to determine the type of cancer a patient might have. The treatment of lung cancer depends on the staging of the disease, and we stage the lung cancer based on the size of the tumour, whether the lymph node surrounding the growth is affected or not, and whether the lung cancer has spread to other parts of the body. For example, if the growth has spread to the brain or to the bones, we typically call this as stage 4 disease. After we have confirmed that the growth is lung cancer, we will do a CT scan of the body to see whether the cancer is spread to other parts of the body to help us stage this disease. In terms of treatment plan, for stage 1 and early stage 2 disease, we will offer surgical resection or surgery to remove the lung cancer from the body. In other stages of the disease, we can also offer chemotherapy or radiotherapy to the patient. However, in late stage or stage 4 disease, our treatment goal shifts to palliative care, where we want to maximize the quality of life of the patient, addressing issues such as pain, breathlessness, and even depression. Smoking cessation remains a part of counselling in all stages of lung cancer, as stopping smoking even after diagnosis of lung cancer will help improve the morbidity and mortality of the disease. Lung cancer can also occur in people who have never smoked before. Risk factors associated with developing lung cancer in these patients include secondhand smoke, occupational hazards such as asbestos or radon gas, and those who are exposed to inhalation of smoke emitted from cooking with coal or wood fire. As we know that lung cancer is strongly associated with cigarette smoking, smoking cessation is an important part in preventing lung cancer. If you are currently smoking, there are tools available to help facilitate smoking cessation, such as counselling, nicotine gums, nicotine patches, and even oral medications to help with the craving of nicotine. Stop smoking today.